Hi, welcome to DrSecrets.com. I'm DR, and today we're going to talk about
ingrown toenails. This is something I commonly see in the office, typically in somebody in their early teens or 20s, so in their tweens, and invariably it's in the big toe. I suppose it's possible to get it in fingernails too, or some of the smaller toes, but generally I would say 99 out of 100 cases I've seen, it's always in the big toe. So instead of Tom Thumb, this is Tom Toe. He comes in complaining that the edge of his toe has been sore for a couple of days. When I look at it, I notice that the edge is kind of fat and swollen. It's red. And if I squeeze on it, not only does he yelp, but I also see a little bit of pus squeezing out the edge of his toe. That would be typical features for an ingrown toenail. And what's happening is, as the name suggests, the nail is running off of its tracks and underwriting into the surrounding tissue. So if I take off my glove here and show you with my thumb, sorry, I probably should have cut my nail before doing this, but what you can see here is the edge of my nail runs along a kind of a groove, or it tracks along this groove. In an ingrown toenail, imagine this, my thumb is my big toe, the nail is actually undermining under the lip or edge of the skin here and biting into it. So it's almost like it's running off its rails and embedding itself. So sometimes I've actually seen that severe enough that it almost looks like a horn is starting to stick through the other edge of the skin as the nail protrudes through. So depending on the severity, there's a number of different treatments. For the common variety, the simplest thing is just to take an antibiotic. I typically don't find that topical antibiotics work that well because their penetration is limited. So we usually give you an oral antibiotic, which means by mouth, and broad spectrum that covers most bacteria coming across. That's typically given for a period of 7 to 10 days. In really severe cases, I may use an antibiotic coverage for up to a couple of months. But that's typically quite unusual. The other thing we'll also advise you to do is to soak it using warm, salty water. All that does is it basically gives you some symptomatic relief, helps soften up the skin, making it easier for the biting that's occurring. So that reduces some of the inflammation. It also helps to dissolve or desolidify or liquefy some of the pussy contents, making it easier for the body to either reabsorb it or extrude it. A third thing that I often will advise people to do is a little technique to allow the nail to find its path back over the corridor of the skin. And there's more than one way to do it. Again, using my thumb as an analogy for a toe, as you can see right now, my nail has grown well past the edge of my finger. A lot of people that get ingrown toenails, what I've found is that they cut their toenail too short. So by losing the leadership of the end plate, I find that that's what allows the entire nail to start swerving off into the skin. So one of the things I'll advise people to do is either each morning after showering let me take off my gloves, bevel the edge of the nail with a small piece of cotton that you roll up and stick it under the nail for about 3 months. As you do that, over time, that edge that's biting into the skin lifts over that edge, and as it grows, eventually it will find its way back onto the normal track. After that occurs, you stop doing the cotton, and then you just cut the nail either straight across or at least giving it some margin past the end of the skin. Most people, again, that are getting ingrown toenails, they're cutting them too short. Another feature that tends to promote them is wearing very tight sneakers. So that cramps the toes and squeezes them together, again, allowing the nail to have a propensity to run off the edge. So that's for simple cases of ingrown toenails. But sometimes it's just so severe, gone on for so long, it's just so bad that antibiotics by itself simply will not work. And in those few cases, then what we do is surgery, basically a surgical resection. So imagine, say this is the toenail, looking at it from the top. So that's a big toe there. Imagine this edge is the piece that's undermining under the skin. There's two broad methods you could do. One is you do a wedge resection. So you basically just cut almost like call it a triangle out of the area. So you take out the affected piece of the nail. Usually a general surgeon would do it. And when he's done, a lot of the time they'll also kill the nail bed where that nail originated from. That's just to prevent it from growing back in the same process occurring again. But that's not always done. Sometimes they leave the nail plate, and as it grows back out again, just watch and wait to see if it becomes maladaptive again. In really severe cases, so I would say this might be like 1% of cases or less, you'll see a general surgeon and they'll just remove the entire bed. So take the whole nail off and use an ablation agent to kill the nail bed. So in other words, the nail doesn't grow back. Or theoretically it's not supposed to grow back, but a lot of the time after several years I usually will see some little frustrated growth trying to occur. So that's it in a nutshell, ladies and gentlemen. Key thing to remember is you're probably not going to be able to treat this just by sitting on it at home and doing soaks. You probably need to see your family doctor. But before it occurs, try to let the nail grow out. Don't cut them so short. And try to wear shoes that have enough space in the toes. And that's it. Stay well.